Okay, welcome to this session on supporting systematic reviews, part 2, which is managing your search results on the new EBSCOhost interface. So for those who are in part 1, we've already covered the matter of creating a search strategy, identifying results, and now we're looking at processing of these results after searching the literature on CINAHL and MEDLINE in support of systematic reviews. So this session will look at the available options for downloading, saving, sharing, creating projects as well in order to process the results in support of reviews. So for those who may not have attended part 1 or attended one of my sessions previously, I'm Richard Crooks. I'm based in the East Midlands in England, in the UK. So I'm a senior customer trained specialist supporting librarians such as yourselves in the UK, Ireland, and also the Nordics. So I'm a chartered librarian, having worked previously as a medical librarian and related roles in the NHS service in England, and now been with EBSCO for more than 14 years in total. So welcome back to part 2. So in terms of the training objectives, I hope that by the end of this session, so within the next hour, you'll be able to save, download, and share search results. Also, you'll be able to export results in RIS and related formats into bibliographic software, and also save searches for future reference, and create projects and add searches and results as well as finding further support for managing searches and results on EBSCOhost. So I hope that's what you're expecting from the session this morning, wherever you're hiding from, as it were. So before I get into the actual live demonstration, I will refer back to the search that we ran in part 1. I just want to highlight some of the key elements that we'll be looking at today in the PowerPoint initially. So first of all, we have this screenshot here in terms of saving records. So again, you can select up to 50. That figure is going to change. I believe it's now 500. So in due course, the interface will be updated to increase the capacity to save records from the results page. So currently, it's up to 50. It's been that way for many years with the classic EBSCOhost interface, but it's going to increase considerably in time. So again, that's in the pipeline, as it were. So you can select the page list of results, so the 50 records, and then you can save those using the save ribbon, the bookmark icon, to your save folder. Now, once you're in the save folder, it will display those records. However, if you don't have EBSCO single sign-on, you will not be authenticated into the folder unless you create a MyEBSCO account. So you can see here the option on screen. So there's the save folder under the dashboard. So for this, you need to create a MyEBSCO account if you want to save the records beyond the session. And there's the prompt to do so, to create the account, and then or if you have a MyEBSCO account and you do not have EBSCO single sign-on, then you can sign in accordingly in any case. So you can also download results in a variety of formats, both from the results list and also within the save folder as well. So this means you can download the records bibliographic data, the metadata, and again, you can select them from the results list within the save folder, click the download option, the download icon, and then you have a choice of format. So it could be PDF, it could be Word, CSV if you prefer, BibTeX, we support that too, XML, and so on. So again, those options are available. And then, of course, you can download directly from the buttons shown. In addition to that, you can also select records to share as well. So you'll see a share icon, that arrow there highlighted on screen. So you can do this from the result that you've generated. And again, this will give you the option to share or Google Drive, or if preferred, OneDrive. And in addition to that, you can also email the records as well. So you can send them via email. Now, when you send via email, if they have attachments, if they have full text, whether be it PDF or HTML, then they will be sent as attached files as well. And then, of course, you can send that to the appropriate email address, be it your own, that of colleagues, or end users. Okay, and in addition to that, we do support the exporting of multiple records. We support, in fact, up to 25,000, as we've done previously with the classic EBSCOhost interface. So on here, you can select the records, and from the drop-down menu, you can select the export results feature, and then you'll be presented. By the way, you can also do it directly from the individual results as well, wherever you see the three dots, this is the what we call the kebab menu, the tools menu, and that will also display an option to do a direct export for records as well. So you can export citations directly, even individual citations. You don't have to export the entire list. And although it is up to 25,000, it doesn't have to be anywhere near that mark. It could be less than 200. It could be 2,000 records. And in total, you can export up to 100,000 records in a 24-hour sitting. So per session is 25,000. That's the maximum from the list. But overall, in total, it's 100,000 in 24 hours. So that just gives you a heads up on some of the key elements, the key features that we're looking at live in this demonstration. And just to also mention here, you can also download the search history as well. So again, you have a choice of formats, PDF, Word, and if preferred, CSV. So again, the search history is displayed here. We'll see that live in a moment. You can select the download option once you've selected the search sets, and then you have the choice of formats shown here, and that will give you these options. PDF is the default, but you can choose Word, CSV, RTF text file as well, and then you select the download option on screen. So again, that's how that works in terms of the actual downloading of the search history. So we will replicate this as we look at the live site. So I'm going to switch now to my demonstration site and my desktop. So in a moment, you should see the search history displayed on screen. So I'm just going to click here and hopefully you can see that now. So if I cannot see that, please do let me know. But so we've got the advanced search page open. Now, for those of you who've transitioned to the new interface, if you do not see the search history whenever you use the advanced search, it just simply means that it needs to be enabled for you. So we have EBSCO Experience Manager, which is the admin tool for the new interface. And it needs to be, there are a couple of places that you need to enable this feature. Okay, so again, if you have access, if you've been searching CINAHL, MEDLINE, etc. on this interface, but have not been using this, it may be because that has not been implemented for you. Otherwise, you should see that, and it may be collapsed by default, as you see here. So within the search history, of course, we've got our records, and again, the option to collapse this is useful because it means you can focus on your search results. So I can scroll down, of course, bypass the search history. It's now 16 lines, and I can see my results below. However, I want to focus on the results initially, then I can just collapse the search history, hide that in the background. It's still there, but it's hidden from view. So what I can do here is begin the process of saving records. So in terms of supporting a static view, it may be more logical at this stage to save a results page or save a list of results rather than look at them individually. You may do that later, but I'll show you both options. So initially, as I indicated in the PowerPoint, you can save up to 50 records. So I select these records here on this page, and you can see it does say 50 items at a time. That will change. Okay, so it'll be a lot more than that. It'll be up to 500 in the near future. So for now, you can select these 50 records, and then you have the option to save them. You've got the ribbon icon there, so just click that icon there, and now you'll see on the top right corner it says they are saved. But it does prompt you to sign into EBSCO to keep them. So if you wanted to keep them beyond the session, you would need to go to the top of the screen, go to EBSCO, and then follow the prompts to create an account or sign in. Alternatively, what you can do, if you want to double check those records are saved, you'd go to the save folder under my dashboard. So click that link on the left there. This gives you the save page, and on here you'll see again this mirrors what you saw in the PowerPoint. So yeah, there's save records below. Notice you can still download it from this list here. You can add to a project. We'll come to that, and you can also export. We'll come to that in a while. But importantly, if you want to save these records beyond the session, which is most likely you will do so, you need to create an account here if you do not have one. Now, for those who work in the NHS in England, you have EBSCO single sign-on, which means through Open Athens, you're already authenticated into your MyEBSCO folder, so you don't need to follow the next step, as it were. So you just add your first name. Again, if you're informing users of this, last name is optional, not required by us. Email address, you create the password, you note the criteria below, and then you also need to agree to the consent form. And for any concerns about data that EBSCO is collating, etc., we have our privacy policy link there as well. And then you create the account. Once you've done that, and of course we do support Google Sign In as well, you can select Sign In here, and then you can enter your email as your username, as it were, and then sign in to access the save folder or to authenticate so that it's now something which, or records are now saved beyond the session. Now, currently at the moment, you'll see it's added these records, these 50 records, to the previously saved records. So there will be coming some bulk delete features to the new interface. There isn't one yet for the save folder, but we do have it in other places at this time. So anyway, the point is that these records are now saved beyond the session. Okay, so that's the key thing here. So I'm just going to jump out of this and go back to the search records or the search results themselves. So let me do that here. Oh, not here, sorry. Come out of that. So I want to come back to this page, sorry. Okay, so we're going back to the search results page. Okay, and again, the search history is hidden from view. So that's saving a list of records from the results page. And you can see again, it shows up to 50 currently, and these are sorted by relevance as well. Okay, now if you want to save individual records, you can do so. You can simply go to the tools menu, etc. You've got tools there to share and so on, or you can just select individual records here, and then you can save them accordingly. So you can save individual records if you prefer to screen them, going through the list like so. Now, if you want to view more detailed information about each article, then you would need to expand the abstract here, unless your default setting is to display the abstract, and that is possible in EBSCO Experience Manager, so it can be displayed as open if necessary. And also, if you want to expand the subject fields, you need to click on that as well. I may have covered that in the previous session. So you can go into these detailed records, and especially when you find something like this first one, which is in really what we're looking for. So if I click on that title link here, again, you have the save ribbon. This has already been saved, so you can unsave things as well, by the way. And you have the references also included here, and you can also save those as well. So you can save even from the reference list, you can save other records here. You can also note there's a button here to see what other references are in the database. So you can see references which are also available in CINAHL, and also those that are full text only as well. So you can filter from this list as well. Now, in addition to saving records, of course, if we go back to the result list, you can download the list as well. So again, you can select these, for example, and you can select the download option, the icon there, and that will then give you the choice of formats to download the metadata, the bibliographic information for these records. So if you want to go for Word, you can choose that option, click download, and then you can save that to your OneDrive, to your folder, your desktop, etc. And then just to show what that looks like, if I just open this up and I'll drag this one on a monitor. So let me just make this a bit smaller. So I'm just dragging this across now. So you can see the 50 records that are listed there, and then below that you'll see we've got the actual bibliographic data there presented with the links as appropriate also. So again, that's a Word document detailing the results, so that having downloaded it, again, if you prefer to have a table or spreadsheet, we've got CSV. If you're an academia in the UK, BibTeX is quite popular, so those options are also available there. Okay, so you can download directly from here as well. And the same applies to individual records as well. So if you want to download this one individual record initially, then you can go to the tools menu on the right and click download, and it will give you this option again, same options, same formats, but for this time an individual record compared to the complete result list as well. And again, if you go into a record, let's go to the next one here, for example, then you will also see those same icons there. So if you want to download this article, this item, then you can click download here, and you can download the full text. In this case, this is available full text in PDF or HTML format, so you can download the full text, or if preferred, just the metadata only, and choose your preferred format. Okay, so again, you see the access options here as well. So again, you've got options to read, etc. So we just go to the online full text here, for example. You can see that full text article in HTML format, and we do support text-to-speech software as well as there, as you see. So if you want to listen to the audio, or if you prefer to download the MP3, we also support that as well. So you can download this offline. But we also have the translation option. So if English is not your first language and you're the child, for example, if we go down, we'll look at let's see here if I can scroll all the way down. I think we have some from Norway, so I'm not a linguist, so I'm going to just choose this one for now. And this will translate accordingly. And it is a machine translation provided by Microsoft. I may have touched on this in part 1 as well. So you can see the language there, and then you can switch back to the original language as needed. Okay, so obviously it's a machine translation. If you're a native speaker of that language, then you'll know how accurate, authentic that is, etc. Obviously that kind of software will improve over time, especially with AI and so on. But that is provided by Microsoft, not EBSCO, so it's built into the system, as it were. So again, you have the option. Again, you have the option to download the article as well, the full text. Again, you can even switch to the PDF if preferred, or the online is here, and its data is available. So again, there are obviously areas where you can download multiple results, a result list, for example, page results, and there's also areas where you can download the individual records as well, the citations and so on. So in terms of sharing as well, we have the share option, so you can select again these 50, and you have the arrow there, so you can share these records. And again, you've got the Google Drive option as well as OneDrive, and also you can share via email if preferred. You can just simply enter an email address there and send it to your inbox or that of a recipient. So if you've run a search, it's the first iteration, for example, in supporting a certificate review, you want to share that with the requester or the team that you're supporting, then you can also email those records to them to check those articles, etc. Or you may want to just send it to another email that you have so you can view those later, as it were. Okay, so that's some options there for sharing. Likewise, again, if we just deselect these ones, if you go to any of these articles, again, this one, in fact, this one here, you'll see the share option is also provided within the tools menu. So again, and this time when you do it from the result list for individual records, notice it gives you the option to create a link to this, a permalink that you can copy to the clipboard. So if you want to share that article with the team you're supporting, with other colleagues, then you can copy that to the clipboard, post it in a Teams chat, post it in an email, whatever it might be, okay, to forward that article to them, that link to the article. Okay, and then likewise, you have the email option there as well. Again, you can enter the email address there. And if you go directly into the article once more, then you'll see the share option is also there as well. Again, from this page, you can also create the link as well, and you can also email it in addition to that. And again, if we go back to the results, and if we go to this full text option here, for example, as you see, full text is available. Then if we go into the article itself and click share and choose email, this time you'll see the reference that the PDF online full text will be included as an attached file. Okay, so you'll get the PDF online full text for this article as it is available full text. Okay. So I think before I go on to the saving, download, searching, I'll also mention the citation tool as well. So you can see here, I can select these records in this result list, and you'll see the cite icon there, the quotation marks, and then you can copy the citation. Notice I've got a default reference style. That may be different for you. Some have APA, especially if they work in mental health. Others have got Chicago, etc., MLA. So again, you can select the default citation format, the style, the reference style in EBSCO Experience Manager. I've done it for Harvard because I typically support the NHS in England and they use Harvard referencing. So again, you can choose whichever format you need to use, and you can switch between them if you need to as well. And then the reference below will be shown accordingly in that format, and you can copy all 50 records using that format to your clipboard. Alternatively, you can also export those records in the preferred format, or in RIS format here, as you can see, or RefWorks. So, or if you're using Endnote, you can export from here as well. So the cite tool allows you to generate the citation in the preferred reference style, but it also gives you the option to export those records as well in RIS format, or for RefWorks, Endnote, and so on. Likewise, for the individual records, you'll see again the cite tool is available, so you can cite individual records as well and export them, as we saw. And if you go into another record here, let's go to this one, then again the cite tool is also available. So where we see those quotation marks, that's the cite tool. So you can copy the citation, and you can also export the citation as well. Okay, so just some extra tools there that you can use. So again, any comments, questions, or feedback? If you've been using this for a while now, it'd be good to hear from you to see how this is coming on in terms of your experience of using it. It is live, of course. It is functioning, and others are still waiting to transition to it. Okay, so in terms of the search itself and downloading, so we look at saving a search initially. So the initial way of saving a search, so you have your search history, of course, as well, but we will go to the tools menu, or search action, sorry, and you can see save search. So click on save search, and then you would change the search name because it defaults to the final query set. So if we put in adult cancer patients and meditation, which is the search we did previously in part 1, meditation, I'll put 2026 just to differentiate for any others that I may have saved. Okay, add a description, so you've got comments you can add here. This is free text. You can see the character limits displayed. You can see the combined search string, which you can copy to the clipboard. If you want to run that search quickly, then you can copy that and rerun that in the interface. So you see the results cited, filters applied, etc., subqueries, and so on. So again, you need to scroll down though to the bottom of the page to save this. Again, this will be in the save folder. So click close. And if we go to the save folder, you'll see the search is being added. So you need to go to the searches tab, of course. Okay, now it does display it in this format, okay, at this time. So I think there's some review of that, but it is available here now. And you can see we've got the filter applied for the date range and also adult age group. Proximity search is the default search mode. And apply current subjects is also being selected, although it may not impact those results directly. So that is there. That is now saved. And also, if we go back, we can also download the search. So that's saving the search, the save folder. I'll say more about that in a moment. But if you open up the search history once more on the advanced search result list page, you'll see we have the option to download. Now, you can resort the search, by the way. So the default sort order is reverse chronological order. So there's a debate, is it ascending, descending, etc. But if you click the ID option, the link above the set number, it will resort. So you can see S1, S2, S3. So on this screen, of course, you see the set number, the search string with the syntax, with the field code indicated. You see the search options displayed, the results, so the hit count, the database. So we are in CINAHL. We could be in MEDLINE, of course, could rerun this search in MEDLINE, but we need to adapt it for MEDLINE given the difference in indexing between mesh terms in MEDLINE and cell headings, and also the options to edit the search details, add to project, and delete. So again, we'll come to add to project. So if you have any duplicate entries, if you spot errors, or you get 0 results, you can delete that set line by line presently. A bulk delete is coming to this search history as well. That is coming soon. But in terms of downloading it, so instead of just saving it, you want to download it with the terms you've used, then you can select the sets here, and again you see the download icon, so just select that link and you see the search summarized, and then you choose the format which is preferred. So if I go for RTF, for example, this time, or say let's go for PDF and then download, then I will save this history, and then if I open it up, you'll see it displays like this. Okay, so you can see it's displayed. Okay, so if S1, we have the original field code search, the title abstract search, the syntax was recorded, the search time when it's run. That in the future will be localized, by the way, so that is coming. So that will be localized. You have the results. So in other words, it won't be the US format for date. It'll be localized. The results number as well is given, and database and so on. So again, you see the various set numbers there, and also where they're combined ultimately as well. Okay, so again, that is in PDF format for the downloadable search history. Now, if you go to recent activity on the left, you can also see the search there as well within search history. You can see S16, S15, so I can resort this. So if I go to newest and select oldest, it resorts in the order that I prefer. And I can also select this, and I can also download from here as well. Okay, so I can do that. Notice there is a bulk delete here option as well, so I can go in and delete sets if I prefer, but it will prompt me, do I really want to do this? And I don't, so I'll click cancel. But it means you can delete the complete search history there. Also, just to show a viewed records here, I've viewed a couple of records this morning. You can also do the same here, as well as saving these records and viewing them. You can also go in and download. You can export from here as well, and also delete as needed. Okay, so if I delete these, this will now clear. So the bulk delete option is available in recent activity, which features the search history and viewed records as well. So again, for those of you who have not enabled the search history on the advanced result list page, you've probably been using this feature, but probably the recommendation is to use the advanced search result list page as it's a bit clearer. Okay, but in any case, you can download those results from there as well. Okay, so that is the saving, downloading of searches for future access and reporting purposes. And what we can also do, if we go back to the result list here, okay, I'll just resort these again in sequence. But what I'm going to do, actually, I'm going to hide the search history here. Again, I'm going to double check if there's any questions or comments coming from this session at the moment. I don't see any. So again, please feel free to post any if you have any. But what I can do here, I can export these. So we looked at direct export individual records, but we can also select here and then choose the export results option here. Now, if you're not signed into my EBSCO, it will prompt you to sign in, but I can now add my email address, and notice it does say the upper limit is 25,000 for one session, okay, from one list as it were, but then the upper limit is of 100,000 in 24-hour period. So again, you know, to just be aware of that. And then you choose the format. So I choose RIS here, then you can send it, okay, and a link will be sent to my inbox. So that shows, by the way, because I've been signed into my EBSCO. If you had not been signed into my EBSCO, you'll be prompted when you go to export to sign in. So this export option works with the my EBSCO folder account, as it were. So I can then close this, and then that link will be sent to my inbox, and I can, you know, extract that data, those records. So I've got 182 references, so all 182 references can be exported in that process in that way. So it could be much larger than that, but it's only it's less than 200 for this particular search that I've run earlier. Okay, so that's the the exporting the result list. Again, you can do a direct export if you prefer. If you click share, oh sorry, that's the email. It's the cite tool again. Okay, cite tool. You do that, and then you see the export citation, so you can export the results in RIS format or for RefWorks, Endnote, and so on. And likewise, if you go to the save folder, if preferred, you can choose, in fact, these ones are not, you can just download it. You can actually, there's the icon is different here. It is the direct export here for these items. So again, the menu is slightly different on this page because it's showing you the direct export icon there. Okay. So those options are available. Now, one thing I haven't shown, and I will show you, is the projects folder. So if I go back to the search, and a couple of things to note here. So with the results, you can select them again, as we would when we're saving, but rather than click the save ribbon, we can select the add to project option there. So click on that, and it will give you a choice of projects if you've created one previously. So what I would do here, I've got these projects here, but I can add a new project here. So a project is simply a personal custom folder that you use to store searches and results from your literature searching. So it's a great way to just differentiate different evidence searches that you may be responsible for. You may be responsible for different departments, different clinicians, different nursing staff, etc. And rather than have a long list of saved searches or saved articles, you can make a distinction between the different topics or different personnel that you're working on, as it were, or working with. So in this case, I can give it a name. So as you see, I've done this before. Okay, I'll put 0226 We're still in February. I may have a due date, so maybe I'm working towards completing this, running another search based on previous search terms, but editing it, and I'm going to get completed by, let's see, by next Friday, for example, 6th of March, as it were. I can add a description, maybe there's some information I need to know about it, maybe it's a contact point for the person I'm doing this for, but it's free text, you see the character limit as well, and you create the project. So what's happened here is that not only have I created a project, but I've also added those results to the project immediately. So if I go to my projects folder under my dashboard, you'll see now that project is listed along with these other 12 as well, other 11 projects I have. So if you click in through to this project, you'll see the records that I've added immediately. So I've, in a sense, bypassed the save folder and saved them straight to a project, which I think is generally possibly a better way of doing it, because immediately you are making a distinction between different literature searching searches, supporting different reviews, etc. And it's easier to maintain that way. And you can see here within this list, again, you can still download the records. You can unsave in this case. You can add them to another project if you wanted to. And you can also do a direct export from this list. So even within the project folder, you can download and do direct exporting. You can also bulk delete them as well. So you may want to go through this list and identify certain articles that are better than others, or ones that are not particularly useful, and you can remove them. So you can just click delete there and delete those records if you need to. Okay. Now, it also means you'll see searches here as well. At the moment, I don't have a search within this project, but what I can do is go to my save folder, identify the search I saved earlier, select it, and then I can add it to a project. And then if I go back to my projects folder, you'll see now under this adult cancer patients meditation folder, not only have I got my records, and I just deleted 2, of course, within the searches tab, I've now got the actual search itself. So I've saved records with the search in the same project. Okay, good question there. Does projects allow us to remove duplicates? I don't believe so at this stage. Actually, it does, in the sense that if you go in to save the same articles, it will indicate that they have been saved before. So let me try this. I know I did delete a couple, but if I go back to the results, okay, on here, okay, so I will select, obviously I can only select up to 50 per page, as it were. If I go into add project, and this one again, yeah, it hasn't done it there, but I know there's an instance where it will prompt you. It may be because I changed the list a little bit there. It will prompt you to say that these have been saved already, or these have been already added to a project. I have seen that before, so unfortunately I couldn't replicate it there, but don't know if it's in the save folder. I'll try save folder. Maybe it's in that instance, because I think I saved them earlier. So if I go to saved, oh, sorry, not there. Just go to select these ones. Yeah, I know there's an instance where it does come up and does prompt you to say that you have saved them before. So I believe there is some work being done in terms of deduplication as well and behind the scenes. So if anyone's had experience of that as well, then obviously please let me know. But I know that I have seen instances where it does appear that you have saved these records. So again, deselect there. Let's see. So let me just come back here. So again, with projects, you can save, and also want to mention here, if you're on a certain page, then you can add. So again, tools menu there for saving searching. You've got the add to project option here. And again, I can add this one, but it might come up this time. Yeah, you'll see here, this item already exists in the selected project. Okay, so if I go in and try this again, out there. If I try another one, I mean, obviously you can see that if I deselect them, actually, let me just deselect here. In fact, maybe I'll need to run this again, to be honest. See, in fact, what I might do here is go to recent activity. I'll just rerun this search, this one again. And it will come in the search history. I'll just duplicate that search basically. And if I try these again, select them all, and then add to project. Yeah, so it does stop you from saving the same items, as it were. So I'm not sure if that's what you're thinking of in terms of removing duplicates. You have got an original result set in the project folder, and then I've tried to add these. It won't let me do that. It acknowledges that these are already saved. Okay, so that does acknowledge that those records have been previously added to a project as well. Okay, so again, you can go into the projects folder, of course, and manage that. You can go in, you can edit the project here, which means you can change the project name. You can extend the due date if you need to, change that. You can also go in and delete. So for example, I'll take one here I've run previously. So for example, this one, or see this one here, I can go in and delete. And again, you get confirmation on screen. Do you really want to do that? So you're not going to make the mistake of deleting it inadvertently. So click delete there. Okay, likewise, go into these projects, and again, you can go in, you can even go in and delete. If you have multiple iterations of the same search within the folder and you no longer need the previous ones, you can obviously select and delete from there. Obviously, I've only got one here, but you can bulk delete or delete individual sets, results, searches within the folder itself. So you can do a lot more in the projects folder, not only downloading, saving, exporting, but also deleting as well from this. And you've also got the option there to edit the project as well. So the complete project, and you can delete individual articles or cite, share, or download from this result list as well. Okay. So that is the projects folder, and I'd also mention, yeah, I think that's sufficient there. So what I'm going to do now is just point out to you that we do have, of course, and by the way, just to let you know, on the projects page, you'll also see this plus sign here. So you may want to set up a project before you start the search, before you start searching for articles in support of a review, then getting into that and creating the search directory. You may want to create the project ahead of time and give it a name and then a due date and description, which means you can then save directly into the project folder, as it were. So again, you may want to do that from the projects folder page immediately that you start the session, as it were, and then it's already set up for you. So whenever you go into a search like the ones we've seen today, like this one, then that project is already there, right? So I select these, select that project, then I know I've already got this one set up here. Okay, otherwise I have to create a new project, which you can do, but it may be more practical to do it the other way around, as it were. Okay, so let's see, let's go to new search here. So back on this page, or whichever page you're on, you can get access to the research tools, and we have the online help menu here. So I'm going to click on that, and that will take you to currently EBSCO Connect, which is the main help site, and it gives you the quick start guide for the EBSCO's interface. So although we look at CINAHL and can be used in MEDLINE, it is valid, it is applicable. You can see there are areas, for example, like browsing CINAHL mesh headings. I'll make this a bit larger. It's quite small. There's also, for example, using the tools, using the bookmark feature. Let's see, using the cite and export tool. Again, there's instructions on here with screenshots, etc. There's also a tutorial that you can review. So again, a lot of information presented via this menu. We've also got saving articles to Microsoft OneDrive. Again, if you're going to save your search, etc. More information about that, etc. Okay, so again, information that's presented here for the EBSCOhost interface, as it were, directly from the help menu there. Okay, so I'm going to stop sharing there and just go back to my PowerPoint. So let me do that now. Okay, another question here. In EBSCO admin, can I switch from CINAHL Classic to the new interface? I only just got my admin. So if you work in the NHS, you are not yet switched over. If you're in universities, it depends what's been agreed, I think, where you are. So at the moment, you may want to speak to your account team locally, or at EBSCO, as it were, to determine what you're actually accessing at the moment. So again, yeah, it would probably be something that's been agreed for your institution. Yeah. So it depends. I mean, what was agreed with the EBSCO account team in terms of a transition from the current or the classic interface, which is still current, to the new EBSCOhost interface. So again, I can't really comment on that. So I can follow up offline about that particular scenario. I mean, majority of project worldwide have moved to the new interface. Okay, and there's still developments taking place. Okay, but I think we need to follow up post-session just to confirm the actual options that you have for that. Thanks for bringing it up. Okay, so we've had a look at the live demonstration again with the new EBSCO interface. To follow part one, the searching, we've been looking at managing search results. Once you've got the results set you're satisfied with, then you can see that we can save, download, or share results using the respective tools. Again, multiple options, whether it's a complete result list, which it may well be with a systematic review, or individual records as well. You can save and download searches for future access and reporting. So again, you can download the search history from the new advanced results list page with the search history that you can view and edit, etc. And you can also save from the results page the search itself, etc. And you can also export individual records or up to 25,000 records from the result list. So you can do the exporting from the result list or the direct export from various other pages within the save folder, the projects folder as well. And you can create projects, of course, and add searches and results to them. So again, the save folder is the generic folder for saving items, saving the search to, but to differentiate and make distinctions between different searches, because you'll be running numerous searches throughout the year, you can create project folders. And it may be a department, it could be like ENT, it could be trauma orthopedics, it could be a clinician, it could be a senior nurse, etc. Or it could be your library colleagues. You may be working together on something. So again, you can add searches as you saw and results to those projects and follow up accordingly. And of course, use the available online help or visit EBSCO Connect for more information, and we'll see something of that now. So in terms of train support, I have included some of the key links to some of the things I've covered today in this session. So using the bookmark feature, exporting results, saving searches, creating projects, and so on. So again, these are updated periodically as well to reflect changes. And EBSCO Connect is still the main support site for EBSCO's databases and so on. So connect.ebsco.com. So you'll find tutorials there, help sheets, etc. And in addition to that, to complement that, or even to highlight more relevant content for yourselves in supporting the use of the likes of CINAHL, MEDLINE, and other healthcare databases on the EBSCO's platform, we have the training resources portal, which gives you links to upcoming training sessions along with previous training recordings, of which this will then be added, and also support information, which gives you links to, again, tutorials, handouts, guides, etc., in particular related to the likes of CINAHL, MEDLINE, and other healthcare resources databases provided by EBSCO. And I've recently updated the list of training sessions for March as well. Okay, so I'm happy to stop there. We are well within time. You can contact me directly, of course, post-session if you need to, rcrooks@ebsco.com. And if you work in the NHS, you have any technical issues, service issues with the interface, then we advise you to contact or raise a ticket with the NHS service desk. Others of you can also log queries with EBSCO Connect if you have an account there. If you need help in understanding how to do that, then we can let you know. But you may want to contact your local EBSCO account team as well for further information. So are there any comments, questions, any other feedback that you'd like to share before we end the session this morning or this afternoon, depending on which part of Europe you're in right now? So any further comments, questions about supporting systematic reviews in terms of managing the search results on the new EBSCO's interface? Okay, I don't see it at this time. Okay, so I'm happy to finish here.